Welcome to another episode of Eat Meat and Question Everything with Devin and Courtney. Today we are joined by Dr. Obadia. Thank you so much for being here with us today, Dr. Obadia.
Sure thing. It's great to be here with you, and I love the theme of your podcast: Eat Meat and Question Everything.
That's what it's like all about, right? Talking to everyone and learning the real facts. So with that, can you just go into a little bit about yourself, what you do, how you got there, the whole 101?
Sure thing. So I am a heart surgeon. I've been a cardiac surgeon now for over 20 years. And during much of that time, I was a very unhealthy heart surgeon. I had reached a point where I was morbidly obese. I was pre-diabetic, and I realized that I was headed for my own operating table, so to speak. And that, was despite the fact that I had been following the advice that I had learned to give, of what it meant to be healthy and how to eat healthy. I had struggled my whole life with obesity, since childhood. And, I had gone through many times where I would, kind of, again, focus and do the eat less, move more, and count my calories. And I would lose some weight, but I'd always end up gaining it back and more. And, about 7 years ago, I really was at a crossroads because, like I said, I didn't know what to do. I knew I was unhealthy. I knew I was headed down the wrong pathway, but I didn't know what to do. And thankfully, I started to come across some different information and ask some different questions, and ultimately, started down the pathway of low carb, keto, carnivore. And since then, I have, improved my own health. I've lost over 100 pounds, which I've been able to maintain. I, now no signs of diabetes or pre-diabetes or any of that. But more importantly, I think I came to realize that, this was the same information that could be helping my patients. And so then I started asking, why hadn't I learned this in school? And why isn't this, what we talk about? And that has really led me to where I am today, where I continue to work as a heart surgeon, but I now have a mission to keep people off of my operating table. And last year I wrote a book, which is now an award-winning bestseller. Thank you. Yep, there it is. And I have a private telemedicine practice that I work with people to help them learn what it really means to be heart healthy and how they should be staying off of my operating table.
Awesome. Love it. Well, back to your book real quick. I just want to say everyone needs this. It is so informative, and it's like an easy read. You don't feel like you're reading some science textbook. Like somebody like me can easily understand it. And I thought it was fabulous. So I just want to touch on that real quick. Devin, I'll let you get at it with the questions. I just wanted to pop that in.
Well, we have like a bunch of questions, but I guess the first thing that I kind of ask is, so you have all these patients coming and you're doing surgery on them. What are these people eating? Because of course we're in the carnivore space. Courtney overwhelmingly gets it more than I do, where, all that red meat, all that cholesterol, you're gonna, heart surgery in a couple years, all the butter, you're gonna need heart surgery. What is the diet looking like of these people who are actually ending up on the operating table? Are they eating copious amounts of red meat and butter? What's just like the basic health and wellness of these people?
Yeah, no, so generally they are not. They are eating either what I would say is the standard American diet, which, yes, that obviously is going to include meat, but it's in the context of lots of processed food, lots of sugar and carbohydrates. And I would say the meat does not make up the majority of the diet. Or, they're eating low-fat diets, which they have been told are the, heart-healthy diet. And we have to realize that, the low-fat, heart-healthy diet has now been pushed for 40 years. And largely, on the macro scale, people are following it. We eat a lot less saturated fat as a society today than we did 40 years ago. And yet our incidence of heart disease has not changed. A lot of measures, it's actually been getting worse the past few years. Our incidence of diabetes and obesity and other, chronic conditions is clearly getting worse. So we really have to step back and say, is this the right diet to be recommending to people? And at this point, I feel very confident saying, no, it is not. And it is not the red meat. It has never been the red meat. There is no good scientific evidence that ever pointed to it being the red meat. And yet it just has become such a pervasive myth in our society and so ingrained in our healthcare system that is the recommendation that you hear from doctors over and over again. And every time it doesn't work, and every time a patient ends up on my operating table and, they've been following the low-fat diet, we don't question it. We say, well, it must have been something else, or they just didn't follow our advice good enough.
Okay. Yeah.
So
Go ahead.
I guess like blatantly, I want to ask, so does fat, like, does red meat clog your arteries? Like, cause that's like the whole thing. Like, people very simply will say butter, red meat clogs your arteries. It's a definitive statement.
Yeah, no, absolutely not. So, again, the theory, I would say the hypothesis is based on saturated fat in particular. And, there are a number of sort of inconvenient truths around this. The first thing is that, when you look at red meat, it's actually not all that high in saturated fat. It has a fairly balanced ratio between saturated and monounsaturated fat, with a little bit of polyunsaturated fat. We look at things like coconut oil that are always put forth as being healthy, and yet that has the highest concentration of saturated fat of any, of basically any food substance we have. And yet no one is saying coconut oil is causing heart disease, but red meat somehow is. The evidence around saturated fat and heart disease is very weak. Epidemiologic data, that doesn't hold up to scientific scrutiny. A lot of the early data that was put forward to kind of promote that theory, we now know was, outright fraudulent and or just very poorly done, depending on how you want to look at things. So again, there was never really evidence that saturated fat was causing these problems. There is no evidence that saturated fat is causing these problems. And, when you take the saturated fat out of the question, what else is left in red meat that we're worried about? Unless somehow we think protein is causing heart disease, we don't really have much else to point to. So it is not, it never was, but that is the pervasive myth. And again, it's very much ingrained in the medical system. Most doctors would still agree with that statement, that red meat is a cause of heart disease, and it just absolutely isn't. And if someone has evidence to the contrary, I'm always open to seeing that. But I would love to see a study that shows, in a scientifically rigorous way, that red meat is causing heart disease, because you simply can't find that evidence.
Yeah, my doctor is one of those that tells me not to eat red meat. So what would you say? So would you say it's the carbs and sugar that are causing the heart disease? And then what would you say like an ideal diet would be? Like, my understanding is I think you're towards carnivore, if not fully carnivore, if you could just speak on that.
Yeah, so ultimately, I think it's processed food that is causing this. There are multiple components of processed food that we should be concerned about. Heavily processed carbohydrates are a concern, and the heavily processed fats and oils that go into processed food are a concern. The polyunsaturated, vegetable and seed oils are a concern. Because again, when you look at the relationships there, one of the other things that I always point out to people is, similar to our overall saturated fat consumption, our red meat consumption has gone down significantly over the past, 50 to 60 years. Yet heart disease is going up. And what has gone up during that time? It's been processed carbohydrates, and it's been vegetable and seed oils. So those are the things that I would point to. For me, an ideal diet is, whole real food, unprocessed food. The balance between plant and animal products within that whole real food diet, I think, can be debated. I believe that protein is important. I know that as humans, we evolved eating animal proteins, and therefore I think that is, that should be the majority of our diet. And as you said, what do I do personally? Yes, I have a largely carnivore-based diet. Am I 100% strict carnivore? No, I'm not. But it is high 90% carnivore for me. And occasionally I might have, a little bit of unprocessed carbohydrates with it, a little bit, maybe some fruit here and there, some nuts here and there, things like that.
Awesome.
So when you say processed, because this, unfortunately, I feel like has to be specified and discussed. When you say processed food, we're talking about like Little Debbie snack cakes and the ice cream and even these like nut bars that are labeled heart healthy. I mean, this covers like a variety of like these packaged
Pantry
foods that are,
I feel like.
yeah. And that's because I feel like, a lot of people will say, well, your meat is processed. And to a certain extent, absolutely. If we are buying it in the grocery store, we have to process it. But people like to take that and run that our meat is processed and therefore our meat categorizes as a processed food. So we're talking about these things with like the seed oils and the things that aren't going to expire within the next 2 or 3 days if we take them off the shelf, right?
Right. Yeah. Generally, my kind of rubric for explaining whole real food to people is your food ideally shouldn't have an ingredient list. You should be able to look at it and know what's in it. These should be things that you could theoretically go grow yourself or raise yourself. I always tell people, eat the things that grow in the ground and eat the things that eat the things that grow in the ground. And if you just stick to those simple rules, you're going to end up in a pretty good place. There's always nuance with everything. One of the other things I tell people is there is no one right diet for everyone. It's going to depend on you, your situation, and even for you, the individual, things are going to change over time. What I needed to do to lose the 100 pounds and reverse my pre-diabetes is not necessarily the same things that I need to do to, then maintain a healthy life and avoid, heart disease and other chronic diseases for the next 40 to 50 years. But eating whole real food is always going to be a great answer and a great improvement. And I tell people to start there. This doesn't have to be overly complex. Just start there, and then you can kind of see where it leads you and what you feel better on, what you tolerate better, what you enjoy better, what you're going to be able to sustain for the long term, because that's another important part of this. If you make some dietary change that you're not, even if it leads to improvement, if you can't sustain it, it's not going to be any good to you. And that goes back to, like I said, I did the, count my calories, eat less, move more. Yes, I lost weight, but I couldn't sustain it because ultimately my body was starving. And, we can't maintain that over the long run. So that does not become a good answer to the problem.
Right. Courtney, did you have a question? I thought you wanted to say something.
No, I'm just like, I want to get into like cholesterol and stuff.
Yeah, that's what
and...
you've spoken a lot on the other podcast, YouTube YouTube interviews about how almost everyone who did come onto your operating table did have low cholesterol. So that in itself really isn't a true indicator of heart health when you look at it as a, I guess, kind of a solo statistic. But what's the whole package? Like, what in itself leads someone to be, because cholesterol is just not an indicator by itself. So what do we need to look for?
Right. So, just a couple of points of clarification there first. When we say cholesterol, what most doctors are referring to are your LDL cholesterol. And that is the one number that they are looking at on your cholesterol panel. And based on that one number, they're going to tell you you're at risk or not at risk of heart disease. And the observation that I have made, the observation that is repeated in the scientific literature many, many times, is that when you look at patients who come in with heart attacks or end up having heart surgery, many of them, probably about 50%, have what are considered low or normal cholesterol levels, within the guidelines, you could say. So that tells me that, that must not be the right answer, or at least it's an incomplete answer if, half the people don't, meet your criteria for risk. And that is really my overall message around cholesterol, is that we can't make this decision. We can't boil something as complex as heart disease down to one number on a blood panel. That doesn't mean that LDL cholesterol is completely meaningless. It just means it shouldn't be our primary focus. When you really look, what are the most powerful predictors of heart disease risk? Insulin resistance is the most powerful predictor of heart disease risk. And so I broaden that a little bit to metabolic health, because the two really go hand in hand. But, it is hard to find patients who end up with heart disease that are metabolically healthy, that are insulin sensitive. Things like smoking can come into the picture, other factors, but, for the most part, while, half of the patients who show up with heart attacks have, what are considered good cholesterol levels, normal cholesterol levels, the evidence shows that if you test for it properly and you look for it properly, 95% of patients who come in with heart attacks have evidence of insulin resistance. So that's where I like to focus on. And, there are a number of different ways to assess that and to look at it. But if the only thing your doctor can discuss with you is your LDL cholesterol level, they are not giving you a complete, picture. They are not giving you a complete assessment about your heart disease risk.
Yeah, that's been my experience as well. Because on paper, mine can look a little bit higher than most people are comfortable with. But my understanding is, with all the other things that come into play, the triglycerides and the ratio and everything, mine is fine. So I'm not concerned, but a lot of other people and my doctor don't realize that. But back to the insulin sensitivity. So what is that exactly? How can we fix that? And then also, how do you know that number? Is that the, I'm forgetting, mine I know is 5.1. I forget what it's called. Is that part of it? It's like the insulin something.
Yeah.
And
so,
can I add in,
Sure.
Is everyone who is insulin resistant a diabetic? Do you have to be a diabetic to be insulin resistant? So sorry to interrupt.
Yeah, no, great question. So no, you do not need to be diabetic to be insulin resistant. Insulin resistance often precedes diabetes by many, many years, decades before. If you test for it, and most doctors don't test for it, the insulin level, which is what Courtney was referring to, can give you an indication of whether or not you might be insulin resistant. If you have a high insulin level, it is likely that you are insulin resistant or on your way to becoming insulin resistant. There's really some more advanced testing that can and should be done to determine insulin resistance. But, basically, if you go to your doctor and you kind of mention some of these things and they look at you blankly and they say, I don't do that. I don't know what that is. I don't know how to test for it. That can be an indication that it might be time to look for a different doctor. Because if they're discussing heart disease risk with you and they're not mentioning insulin resistance, like I said, they are doing a incomplete job of assessing your risk for heart disease, and you need to find someone more advanced to work with. The other important thing about insulin resistance to understand, though, is that it's not just heart disease risk. Many forms of cancer have been associated with insulin resistance. Alzheimer's disease is associated with insulin resistance. And when we go down the list of, the top 10 causes of death every year, most of them, 7, 8 out of the 10 of them, are associated with insulin resistance. So this is what's even more powerful about insulin resistance. People come to me because they're concerned about heart disease, and we start talking about insulin resistance. And then I'm able to say to them, oh, by the way, not only have we lowered your risk of heart disease, we've also lowered your risk of Alzheimer's disease, many forms of cancer, diabetes, kidney disease, all of these other chronic medical conditions.
Okay. Yeah. So I think that the thing I was thinking of, is it A1C? Is that?
Oh, okay. Yeah.
Is
yeah.
that the
So
number? Okay.
The
So,
hemoglobin A1C, that's going to be basically an average, reflect your average blood sugar over a 3-month period. And again, it's already late in the process when that becomes elevated. Most people who have an elevated A1C have had insulin resistance for a long time. It's just that most doctors don't test for it, don't look for it.
okay. And then, so we don't want to be insulin resistant, right?
Correct.
Okay.
Yep.
These like double negatives, I feel. Okay. So how do we go on that path? Is that again, like the carbs and the sugar and being overweight that are leading us there? Or can you be thin and eat junk and still have that issue?
Yes, you definitely can be, normal weight or even underweight and be insulin resistant. The statistics again show that overall in the United States, 88% of adults are not in good metabolic health, which is essentially synonymous with insulin resistance. But even when you look at the people in that study who were at normal weight or underweight, half of them were not in good metabolic health. So, being obese, being overweight certainly makes you more likely to be insulin resistant, but being lean does not guarantee that you're, not insulin resistant. You really got to test for it specifically. And there are a number of different tests that can be done for it. The gold standard test is what's called a Kraft test, Kraft, ironically, like the processed food, but this is actually named after Dr. Kraft. And that's a test where you actually drink sugar. You drink a sugar solution that has a known amount of sugar in it, and you look at what happens to your glucose levels and your insulin levels over, about a 3-hour period. It's a kind of difficult test to do, so it doesn't get done a whole lot, but that's sort of the gold standard. There are some other testing that can be done, but usually I just start with, what's your fasting insulin level will give you, and that's an easy test to do, inexpensive, any doctor can order that test for you, and just start there to figure out, if you're insulin sensitive or not.
Okay, great. Thank you.
Did you want to ask a question about pre-existing conditions?
Oh, yeah. So we actually reached out to our audience on things they wanted us to bring up. So pre-existing conditions, like what they should do. A lot of these people, this is coming from people that are carnivore or interested in it.
Yeah.
So a few that specifically I want to ask about would be like someone that has a stent already, and then somebody that I'm going to butcher. What is it? Chronic heart failure or I feel like there's a
Congestive
difference
heart.
between congestive heart failure. Yeah. So any of that, if you could touch on that, like if that can be, what do you do?
Yeah, so the name of my book is "Stay Off My Operating Table," but the truth is that I give it to all my patients who end up on my operating table, and it applies to them because no matter how advanced your heart disease might be, if you've had stents, if you've had a heart attack, if you've had heart surgery, or even if you're in heart failure, you can always improve things by improving your metabolic health and focusing on, proper diet and getting good activity and all the other tenets of metabolic health that I talk about in the book. So it's never too late to improve this. The earlier you start, the better, but it's never too late to start this. And one of the things I always tell patients is, no matter how good a heart surgeon I might be, or all the other heart surgeons out there are, you're never as good after you had the heart surgery as you would have been if you didn't need the heart surgery in the first place. And so that's why, I now focus so much on helping people to stay off of my operating table. And if you already have heart disease, it's an even more important reason to start today and start improving your metabolic health, start eating whole real food, and, get more activity throughout your day, build muscle, all these other things that contribute to metabolic health.
Okay, so and I guess what their question is also coming from is they see this carnivore stuff and they're interested and they have like the old information of meat is bad for our heart. So just to like clarify, like if someone is wanting to go carnivore or keto and be very meat heavy and they have the pre-existing conditions, like this would still be considered safe, right? For them?
Yeah, exactly. I would still consider it safe. Very important to be, these are the situations where you really do need to find a good doctor to work with and to guide you through this. I do always caution people that these aren't things that you necessarily want to be doing on your own. I know it can be challenging to find a doctor that will work with you on that. You're going to have to put some effort into it. But they are out there. We are out there. Physicians like myself, and I work with patients, all across the United States via telemedicine. I see no reason, and I have now recommended for many of my patients who have had heart surgery, a carnivore diet, and I see no reason to avoid it.
Okay, perfect. Devin, unless you have something, I have more questions, so go for it.
Okay, I'm gonna ask my question, and I'm gonna let Courtney go crazy because she's been looking forward to this for a long time. I am just so curious because of like what I've seen Sean Baker go through with his. I have to ask the type of pushback that you've gotten from your community of doctors. What kind of feedback have you gotten from the medical community in regards to this?
Wait, real quick, Devin, what do you mean what he's gone through? Just the pushback or did something else?
Well, I mean, I guess it's okay to talk about it. He got his license. They were going to revoke like that because of him starting to recommend the carnivore diet. And of course he got it back. And then of course was like, no, I'm going to do my own thing. So I have to ask what your experience is with that, just because of the almost kind of like taboo nature of discussing a carnivore diet in the medical community.
Yeah, so thankfully, I haven't had to go through, what Sean Baker went through, what Tim Noakes went through, what Gary Fechte went through. But at this point, I'm confident that if it were to get to that point, I can defend, everything I've done. And I think low carb, carnivore, these are all defensible with the scientific literature. We are not doing anything that is outside of, it may differ from what most doctors consider to be the standard of care, but in no way do I think we're abdicating our ethics or our standard of care as physicians. In fact, in a lot of ways these days, I think just following the guidelines, should be questioned as whether that should be considered, sort of malpractice. the pushback that I get more is, on the individual level, where I see a patient and, I recommend these changes to them. And then they come back and say, my cardiologist said I can't do that it's going to kill me, or my family doctor said, that we can't be doing this. What I unfortunately see way too often is I'll be working with a patient. They'll lose weight, they'll get off their blood pressure medication, they'll reverse their diabetes, they'll have all of these great changes. And then, they cycle back to see their primary care doctor for their once a year visit. And, he will just look at that LDL cholesterol number, which may have gone up, and understand in a lot of situations it doesn't, but sometimes it does. And based on that one thing, despite all of the other evidence of that patient's health improving, that they're going to say, oh, you can't continue doing this diet. Look what it's doing to this one number. And again, it just, that thinking just kind of amazes me at this point, that we can be so narrowly focused on one number and we can ignore all the other, even if we believe that number is what it is, and that number going up means you're at increased risk. We have all these other clear markers of risk that have improved. So the totality of the evidence is that we are improving things. That is kind of the pushback that I oftentimes get. And, the only way to overcome that right now for me is just working with the patients one-on-one and explaining my perspective on things. And, I'm always honest with the patients. I tell them, I'm not here to tell you what to do, nor is your other doctor, by the way. I'm here to advise you. I'm here to educate you. This is what I have learned. This is what I have observed. If you want to get into it, this is what the scientific studies show. We usually don't get that deep into the conversation, but I'm certainly willing to. And judge for yourself. Try for yourself. Ultimately, everyone needs to sort of run this experiment for themselves and see, do you feel better on it? Does it improve your health markers? That's sort of the attitude that I ultimately end up taking.
That reminds me. So I started off on keto. It's a keto for 4.5, 5 years. And I started keto because I had gained a lot of weight after my first pregnancy and I wanted to lose weight, but I also had Hashimoto's for 13, 14 years at this point. And I went keto, I lost 60 pounds. I never needed, I didn't need any more thyroid medicine anymore. And I had moved across the country and got a new endocrinologist and went to get my labs checked. And of course I explained, I've lost 60 pounds. I was on levothyroxine for 13 years. I no longer need it. And the only thing she saw was my cholesterol. I think I had a cholesterol of 210, which isn't even that elevated. And she's just like, I'm very concerned about your cholesterol. And I was like, what about all the other amazing things that I just did with my body over the past, year and a half? And she's like, eat less fried food. No, so I don't eat fried food. So I can totally see that, because I think we've both been, on the reciprocating ends of kind of being gaslit into that, thinking with a very narrow mind of that LDL is the only thing that matters.
Yeah. And it's so dismissive to everything else. Well, speaking of medications, can you touch on at all, people being on blood pressure medications and statins, and I don't know, maybe this borderlines on, medical advice that you can't give, but is there a general, hey, if you start eating this way, how long could you maybe wait and then go off your meds? How does that come into play?
Yeah. So, when we look at things like blood pressure medication and diabetes medications, I oftentimes see patients able to reduce their medications and, get off them completely when they make these diet and lifestyle changes. And sometimes these changes happen very quickly, within the first couple of weeks that we start reducing or even start eliminating some of these medications. The sort of big picture, I guess, that I always push people to discuss with their physicians is, if your physician is starting you on a medication for one of these conditions, you should be asking them, what's the plan here? Am I just going to stay on this medication for the rest of my life? Why do I need this medication? What is the root cause of my condition, and how can we address that? Because when you address root causes of problems and you correct root causes of problems, the problem should go away. And if you're giving a medication and the problem isn't going away, then that obviously isn't, addressing the root cause. It's maybe controlling the symptoms. It's controlling, whatever's going on, but it's not addressing it. It's not improving it. So these are the questions that, we should be asking our doctors more commonly. And if your doctor isn't open to having these conversations with you, if your doctor's only answer is, this is what the guidelines say, or, if you don't take this, you're going to die, then that, I think, is, that doctor is doing a poor job, quite honestly. And understand, I do want, doctors are trapped within the medical system these days. They oftentimes don't have the time to discuss these issues with patients because of our model. They are not properly educated to discuss these issues. It may not be that your doctor is, in most cases, it's not that your doctor is, trying to harm you or doesn't want to do the best thing. They simply don't know. I mean, most of what I talk about these days is not what I learned in medical school. It's stuff that I had to go, educate myself on. I oftentimes had to look outside of the medical system for some of this education. And, many doctors just aren't able to do that. So, don't necessarily, blame your doctor, but recognize that that might not be the right doctor for you to be working with.
Yeah, that makes sense. So like if someone's on these medications, and they're getting it checked, it's making it be okay. Like if you're on blood pressure medication, your blood pressure is probably fine. So do you just change your diet for a while and then hope for the best, go off of them and then test again? Or for like the statins, go get blood work done and then hope for the best and go back on it if you need it? Or how would you even suggest like weaning off of them?
Yeah. So again, something you want to be working with a physician on. Statins are really a whole different issue. A whole sort of complex issue and discussion to get into. But when we look at something like blood pressure medication, the progression that I oftentimes go through with my patients is we make the changes in their diet, in their lifestyle, and many times they recognize that their blood pressure is getting too low and we need to get them off of it. Sometimes it's just a gradual process that I start as they're making these changes. But typically we are able to get them, reduced on their dosages or off of their medications. But it's important to be working with a physician on this. And, this isn't something that you necessarily want to be doing on your own. So I would start with going to your physician and having the conversation. I have made these changes, or I want to make these changes. Many people, get off medication when they do this. Can you help me, do the same? Or, are you willing to monitor me and, be checking my blood pressure to know if it's time to come off it? Those types of conversations are the ones we need to be having with our doctors.
Okay. Yeah, that makes sense. I wasn't even thinking you could still be on them, test your blood pressure. And if it's low, then you're like, okay, obviously you want to come off of them. So that makes sense. Okay, Devin, do you have anything or?
I think like go ahead, go for it, girl.
I have one more, I feel like. And then we could probably let you go. The whole artery thing, that's going to clog your arteries. What can you just talk on that in general and what is clogging them and what they're clogging onto and all that?
Yeah. So, when most people talk about heart disease, The most common form of heart disease is what's called atherosclerotic heart disease. And what this basically means is that plaque, builds up in the arteries, along the walls of the arteries. And over time, that can narrow the artery so that there's not enough blood flow through that artery, or pieces of this can break off and actually cause a blockage of the artery quickly. And these are things that then lead to heart attacks. That whole process starts with damage to the blood vessel wall. So we have to realize that, cholesterol is in our bloodstream, from before birth. Cholesterol is an essential part of life. We cannot live without cholesterol. It serves many, many purposes in our body. It makes up the structure of our cells. It's part of our immune system. Lots of other, reasons that cholesterol is there in our bodies, and it's always in our bodies. So what makes it start to build up on the wall of blood vessels? And there is cholesterol in the plaque that forms on the wall of blood vessels. That's why it sort of made sense to say, maybe if we're eating more cholesterol, we get more of this plaque. But the problem there is that, the blood vessel wall needs to be damaged first. And that's what we should be focused on. And those are things like insulin resistance, high sugar levels, smoking can damage your blood vessels, so lots of things can damage the blood vessels. But if you don't damage the blood vessels, then you don't have to worry about the cholesterol. And it's not entirely clear that if you are damaging your blood vessels and you're continuing to damage your blood vessels, that trying to lower the amount of cholesterol in your bloodstream is, of much use, because again, you're not addressing that underlying root cause. So that is what people talk about, you block up your arteries, you clog the pipes. But again, it's not because of the cholesterol. It's because of the damage that was done to the blood vessel in the first place. And that's what we need to be addressing.
Okay. That's like the little saying, when there's a house fire, it's like, don't blame the firefighters. They didn't do it. They're just there. But
Yeah.
this makes me wonder, can you reverse damage to your blood vessels? Like if you've been eating a crappy diet and then you go really healthy, can you heal that and smooth it back up?
Yeah, so controversial topic, I will say, but I do believe so. Our body has amazing capacity to heal itself. What I do know we can do, and this I would say is not controversial, is we can at least stop doing damage. And whatever place you're at, if you stop doing damage and you stop it from getting worse, then you're probably going to be all right over the long term. You're lowering your risk of problems developing over the long term. I have seen patients, for instance, who have lowered coronary artery calcium scores. That's one marker of this damage that we can look at. And again, I've seen it. It's published in the literature. It can happen, but it's not well accepted. And my first step with people is always, let's stop doing more damage, and then we can figure out, can we undo the damage that's already been done?
Okay, that makes sense. And sorry, one last thing that just reminded me, the CAC test. Who do you recommend that to? How often? What age? Like, should we just be going and randomly getting them done every year?
Yeah, so coronary artery calcium, CAC scan, as you said, it's a non-invasive. It is an X-ray test, so it does involve some radiation, but you don't need an IV put in. They're not injecting anything into you to do the test. So it's a pretty simple test to do. It's typically relatively inexpensive. I've seen it anywhere between $50 and $200 to get the test done. And it will show you whether or not you have calcium in your arteries, which is one of the other components in these plaques. I believe the test should be more widely used than it is. That I can say pretty confidently. When you should start getting it done, how old, I think depends on your situation. what I can tell people is that I end up doing heart surgery on 30 and 40-year-olds these days. So is it too early to start getting these tests done when you're in your 30s? I would say probably not, especially if you're in a situation that makes you concerned about your risk of heart disease. If you have strong family history, if you have, evidence of insulin resistance, if you're diabetic, if you have high blood pressure, some of these conditions that predispose you to it, it's probably not too early. How often to get it done is going to depend on what the results show. If you have a 0 score, you have no disease in your arteries, and you're 30 years old, that probably doesn't mean a whole lot for your long-term picture. For the next couple of years, you're probably all right. But, you probably want to check it again at some point. If you're 80 years old and you have a 0 score, that's almost a lifetime guarantee that you're not going to die of heart disease. You might die from something else, but very low chance that you're going to die from heart disease. So, it's just one part of the puzzle. Similar to, how most doctors put everything on LDL cholesterol, we shouldn't be putting everything on the CAC score. It's just one part of the puzzle. And ultimately, you should be finding a practitioner, finding a physician who understands all this, can help you decipher all this, because it is a very complex topic. Heart disease is not simple. There isn't one simple answer to this. And it's very complex, and you need to be working with a good practitioner to figure out what's your risk, when does it make sense to do these tests, what do we do with the information that we get from this testing.
Wow, this is all so fascinating. Devin, do you have anything else?
No, I'm good to let him plug where he is so people can find him. And then we always ask 3 really fun questions at the end of every interview.
Sounds good.
Before you tell everyone where to find you, are you taking on new patients for telehealth right now still, or?
Yeah, so I have a telemedicine practice, a private telemedicine practice where I do work with patients one-on-one. That is Ovadia Heart Health, and you can go to ovadiahearthealth.com and find out about that. I see patients throughout the United States via that practice. I also have a coaching program. I have coaches that work with me, share a similar philosophy to me, and are able to work with more people, lower price point. It's kind of a more scalable program, and that's available at ifixhearts.com. So those are the 2 websites to go check me out. All of my, social media wise, I'm most active on Twitter. And again, that's at ifixhearts. The book is called Stay Off My Operating Table. It's widely available, and I encourage people to start there as well.
Awesome. Yes, definitely. You guys go get his book. If you're only listening, I'm showing it to you. So go look on YouTube. But I mean, I can't recommend it enough. First of all, on page 3, I was already crying from the first story of the lady that she went on your table. I'm recommending it to everybody. I mean, regardless of what diet you eat, and it's not even like me trying to push carnivore on anyone. It's just like, you need to read this to hopefully, live past 100.
Thank you.
All right. Are we allowed to ask you 3 fun questions?
Sure thing.
Okay. We ask these to everyone. So number 1, what is your favorite curse word?
What is my favorite curse word? I have young children, so I try and avoid them. But I'm gonna go with, I guess I'll end up going with fudge. Is the one that I end up using most often.
Everyone except for one person said the F word, so you're in good company. The second one is, when you were not on this carnivore animal-based journey, what was your favorite junk food?
So I certainly, I would say, have the sweet tooth, and particularly chocolate, for me, it's probably a good, chocolate peanut butter ice cream I would put at the top of my list.
That sounds
That
so
sounds
good.
so good. Always sounds good. And then last question, what are you currently reading or watching?
I'm going to go with reading because I don't end up watching much these days. So reading right now, I have a couple of things on my, I would say reading 2 books actively. One is Dr. Christopher Palmer's new book, brain health. That, knowing Chris and seeing everything that he's been doing to promote the relationship between metabolic health and mental health, I think is very important. So I highly recommend his book to everyone. And then the other half of my reading ends up usually being kind of personal improvement and business development. And right now, reading Tom Ziegler's book, Choose to Win, would be or the 2 that I'm currently working through.
Nice.
Well, that is wonderful.
I've heard a lot about the first one, Palmer's Brain. What is it? Brain Energy something? I forget the title of
Brain
it.
Energy, yeah.
Brain Energy. Yeah,
Yeah.
I've heard it's fabulous. So that's on my list too. So awesome. Always fun to know what the pros are reading. So thank you so much for being here. I know this is going to be so informative and helpful to everybody listening. So we really appreciate your time.
Very good. Great conversation with both of you. And I hope your audience found this useful.
I'm sure they will. Thank you.